Hi, my name is Alexis. I'm going to be your student nurse today. Today I have my patient, Mr. Tissue Box, and I'm going to be doing a wound irrigation and cleaning and dressing change. And I have already introduced myself to my patient. I've already gone over his records, seen if there is any pain-reducing interventions needed. Now I'm going to perform hand hygiene. And I'm going to put gloves on. So, and I would, if there was a cover over my wound, I would use the lift and push method to remove that, to make sure that the wound is open and visible for me to check to see if there's the color change. I would measure the size. I would note any changes in smell, odor, and color. Up my sterile field, starting with my drape. I'm going to open it like this and be careful to only grab the corner. And I'm going to lift it up above my head, above, so there's nothing touching it. I'm going to open it up like this, and then I'm going to lay it flat on my table like this. And now I'm going to grab all my items needed. I'm going to open it up like this and make sure I'm at least 6 inches above, and I'm going to drop this. Save for later because you will need that. I'm just making sure not to put it on my sterile field. This you can put by your patient to have for later. And so I did drop an abdominal pad, so I would just come and I would throw this one away and grab a new one and throw that. I'm making sure that I'm not reaching over my sterile field. And if my patient needed any ointment, I would squeeze it on the corner of the sterile field, noting that it is there. So now I'm going to take some of the sodium chloride and I'm going to pour it into my gauze container to do a wet dressing. And I would, since it's unopened, I wouldn't have to do a lip pour first. I can just pour it right in and close it back up. So next I'm going to be putting on my sterile gloves. I'm opening the package and grabbing the corner and unwrapping it, making sure I have the cuff end facing towards me. I'm going to grab the corners and then open the sides up, making sure not to touch the sterile. Then with my non-dominant hand, I'm going to put on my dominant glove. And then I'm going to reach under to And now that my gloves are on, you can see that I made mistakes, but I'm touching sterile to sterile, so I'm able to fix that. Same with my other hand. And I would pinch the inside of this because that's sterile to sterile, and I would discard of that. Now that I have put on my sterile gloves, I am able to touch my sterile space. So first I'm going to take my syringe and fill it up with the irrigation solution. And I'm going to take it to my wound, and I'm going to go back and forth, front, top to bottom, irrigating my wound. And you have your tray underneath to catch all the runoff water. Then dispose of that. I don't know what's next. And next, I will take my Q-tip with this hand, and I will put it in any topical solutions that may need, medications that need, and I will apply that around my wound and discard of that. So after that, I am going to take, I'm going to take my wet dressings that I put in my solution. I'm going to pick one up with my sterile hand, and with my clean hand, I'm going to take a Q-tip, and I'm going to start at one end and carefully pack in the wound. This one's quite a big wound, so I would take another piece of wet gauze and pack that in to my wound, and I can discard of this. So then I'm going to take a dry piece of gauze and lay it over that, like that. And then I'm going to take my abdominal pad, put it over the wound, and take tape and tape it. And I can remove my gloves at this point. And I would take a piece of tape and put it on top of the wound, on top of the pad, and I would write my name and when the wound was changed. And then to end my care, I would perform hand hygiene, and that is how you do a wound care and irrigation.